Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. This is the first minisode of our new podcast, Healthier Together, where we'll provide a brief update on local public health news. So, Tom, what's up in public health?
Well, first up, we have our Communicable Disease Epidemiologist, Abi Collingwood, here to give us an update on respiratory viruses in our community. Abi, thank you so much for joining us.
Thank you for having me.
So what are respiratory viruses, and why is there a respiratory virus season?
Yeah, so a respiratory virus is just any virus that causes an infection of your respiratory tract. So the lungs, your throat. The symptoms of respiratory viruses, you're going to have your cough, your fevers, your runny noses, sore throats. Here in the county, we monitor 3 respiratory viruses: COVID, influenza, and respiratory syncytial virus, or RSV, because these can cause really severe infections and hospitalizations. But there are a lot of other respiratory viruses. So the common cold is a respiratory virus that's often caused by rhinovirus and adenoviruses. Notably with respiratory viruses, they are viruses, not bacteria, so antibiotics will not work on these infections. And I really like your question about why is there a respiratory season. So when we talk about that, we're really thinking in the northern hemisphere about the months between October and April. And there's a couple of reasons why we see respiratory viruses really spike in this time frame. So one is we have a lot more people indoors with less fresh air. So kids are back in school, just swapping microbes back and forth, bringing it home to their families. We have our holidays where lots of people are getting together. And then just colder weather, people are inside more as opposed to being outside in the fresh air. And then viruses really like winter weather. So they survive better outside the body in lower humidity, and they actually transmit better in lower temperatures. It's producing a better aerosol, so the virus can linger longer in the air and have more time to transmit to someone else. And then your immune system does not like the winter weather. So with less humidity, in Colorado, you get that really dry nose and dry throat. You're making and clearing a lot less mucus, which is our first line of defense against these viruses. So your throat's super dry, you don't have a good defense, and the viruses can just move on in.
What does the respiratory virus data look like right now in Larimer County?
Yeah, so I'm sure a lot of residents have been hearing about the flu. I feel like we all have had the flu or know someone who has had the flu. And you're right, it is a really severe season here in Larimer. We've seen more hospitalizations in 1 week than in any other week in the previous seasons. We've had more emergency department visits for flu than we did last season. And that's really saying something because last season was a really high season as well. And I think when people think about flu hospitalizations, they're thinking about our older population. It has hit them really bad, but we've also been seeing this in kids. So we've had about 20 kids hospitalized in our county. Thankfully, we are maybe starting to come down from our peak of flu. We've seen a decrease in cases lately, but we have had seasons where we've had more than one peak. So even though we're coming down, we're not out of the woods yet. Some good news, though, I'm not just the bearer of bad news, is our COVID remains low. We are seeing some outbreaks in long-term care facilities, but we haven't seen as many hospitalizations as we had in previous seasons. And then with RSV, we are starting to see this pick up. It is a lot later than it has been in previous seasons. We're currently at a moderate level, and this is mainly in our 0 to 4-year-olds. RSV is most severe in that population.
Gotcha. So it sounds like this is much kind of in line with the trend of things that are getting worse each season. So it sounds like it's in comparison to last season, it is worse.
Yeah. So that's an interesting thing that you say in that, the seasons are getting worse. The CDC has actually never seen back-to-back severe seasons since they started looking at that in 2003. So the fact that we had a bad season last year, a lot of people were thinking it would be a less bad season this year. But since we do have a new strain of the flu, H3N2 subclade K, we might be seeing our first back-to-back severe season.
Wow.
Abby, why is this a public health concern? Everyone has gotten a cold during the winter and recovers. It sucks for a week, but you get better. Why is this something that the health department collects data on and shares information about?
Yeah, that's a really great question. So there's a lot of reasons why. First, flu, COVID, RSV, these viruses are different from the common colds. So they can produce more severe infections, which is why we track these ones and we don't track the colds. And then second, while these viruses may be mild in some people, I've had COVID and it just meant I had to lay on my couch and watch Gilmore Girls all week. Some people, it can be really severe for them. And so influenza and COVID can cause hospitalizations and death, especially in our older population. But as I mentioned, we've been seeing kids get hospitalized with these conditions. And then RSV is actually the leading cause of hospitalization for infants in the United States. So these are really severe infections for some people. So that's why it's important that if you are sick with these viruses, even if it's mild, that you stay home so you're not infecting somebody who could have a more severe reaction. And then beyond the individual level of people getting sick and getting hospitalized, it's a really big public health concern because we are trying not to overwhelm our hospital systems. We've seen this in the past during respiratory season when so many people get COVID, influenza, RSV, that our hospitals actually run out of beds for patients and have had to turn people away who are coming in for things like elective surgeries. So it's important that we keep our hospitalizations down so our hospitals can continue to provide the best care possible. And then finally, I know I keep talking a lot about severe infections, hospitalizations, deaths, but I don't want to discredit how disruptive a mild case can be. Even if you're not hospitalized, that can really impact your life. You could be missing school, missing work, missing parties with friends. We really want to prevent these illnesses so everyone can keep living their healthiest and fullest life.
So where is this data coming from, and can Larimer County residents access it?
Yeah, so the data comes from a lot of different sources. We try to monitor a variety of sources to paint the most comprehensive picture of respiratory viruses in our county. So we look at hospitalizations, emergency department visits, outpatient visits that are reported to us by our healthcare partners. And then we're able to monitor outbreaks that are reported by our schools and our long-term care facilities. And then we have compiled all of this into a one-stop shop for our Larimer County residents at our respiratory virus dashboard.
What can people do to keep themselves and others healthy this season?
Yeah, so the first tip I would pass on is staying up to date on your vaccines. So we have a seasonal flu vaccine and a seasonal COVID vaccine. And then really excitingly, we have some RSV protection. So older adults could be eligible to receive a lifetime dose against RSV. And then our infants can now be protected in two ways. So first, pregnant people can get vaccinated, and this can pass on antibodies to their newborns. And then babies can get monoclonal antibodies against RSV. This is super exciting. It's probably one of the reasons we're seeing a lower RSV season this year is because we've had such good uptake of that protection. And then outside of vaccines, just general respiratory etiquette. So practicing good hand hygiene, washing your hands frequently, staying home when you're sick so you're not passing this on to others, covering your coughs and your sneezes. And then if you're hosting people, see if you can open some windows to let some fresh air in and really increase your ventilation there. And then if you are at risk for severe disease, you could consider masking when you go out and then avoiding large crowds.
Abi, thank you so much again for joining us. We really appreciate you taking the time.
All right. Thank you.
This week, we also have our medical officer, Dr. Paul Mayer. Dr. Mayer, thanks so much for joining us.
Glad to be here.
As we've heard, flu activity is currently very high in Larimer County. If you haven't gotten your flu shot yet, is it too late?
No, by no means. If you have not gotten your flu shot yet, we strongly encourage you to do so. It takes about 2 weeks to get full immunity from your flu vaccine, but the immunity does start right after you get the shot.
We've also gotten some questions about this year's flu vaccine not being a good match for the dominant strain of flu that's spreading in Larimer County. Is it still worth getting this year's flu shot?
Yes, absolutely. It is accurate to say that this new subclade that is dominant, subclade K, is less protected by the flu shot as far as getting disease. However, we have some excellent data to support that your likelihood of getting severe disease is greatly reduced by this year's flu shot.
And then who is most at risk for severe illness and hospitalization from the flu?
The risk groups are similar to other diseases, so it's going to be young children, the elderly, and anybody with any type of chronic disease, really, whether it's heart, lung, kidney.
You can learn more about respiratory viruses and find the Larimer County Respiratory Virus Data Dashboard at larimer.gov/stayhealthy.
Well, we are lucky to be joined by our environmental health planner, Lea Schneider, here to talk about radon. Lea, thank you for joining us.
Of course. Thanks for inviting me.
First, can you explain what radon is and why we're talking about it today?
Yeah. Radon is a colorless, odorless gas that is radioactive, and it comes from the soil. It enters our homes through cracks in the foundations, where pipes enter your home, sump pumps, drains, as well as your crawl space. Prolonged exposure to these elevated levels of radon can cause serious health effects, including lung cancer. And a lot of people don't realize that radon is actually the leading cause of lung cancer in non-smokers.
Is radon common in Larimer County?
Radon is very common. Over 50% of our homes actually have levels detected above the EPA's action level of 4 picocuries per liter.
That's like 90,000 homes in Larimer County. That seems like a lot.
That's why Radon Awareness Month is so important to us. Through the month of January, our department works to raise awareness of the health risks associated with exposure to elevated radon levels, as well as provide some resources for testing and then mitigation resources for taking care of those elevated radon levels in your home. Because you can't see or smell it, you have to actually test. Test kits are simple to use. You just place it on a steady surface in the lowest level of your home. And this could be either the basement, if you actually occupy the basement for an office or a bedroom, or if you don't have a basement, the first level of your home. And the test kit is activated by opening the package and exposing it to the indoor air for a certain amount of time. And then that time is outlined in the instructions that come with the kit. And then after the few days the test is complete, you'll package it up and it's sent off to a lab, and the lab will send you the results to determine how much radon they've detected in your home.
Where can you get a radon test kit?
Larimer County residents have a few options this January. You can order your free test kits online. We have them available at larimer.gov/radon. Our health departments in Fort Collins and Loveland, as well as our partners in Estes Park at their town hall, and then libraries in Red Feather and Berthoud will all have free test kits available as supplies last. If these kits run out, you can also purchase online with vendors and retail stores.
So let's say I get a test kit, I open it up, I activate it, I leave it in my basement for up to a week, send it off, I get the results back, and the results say that I have elevated levels of radon. What can I actually do?
The most effective way to actually reduce radon in the home is to install a radon mitigation system. Radon mitigation systems remove the radon gas from the soil around your foundation and then safely release it out into the outside air around your home. And then the Colorado Department of Health and Environment maintains a list of these certified professionals that can actually install these radon mitigation systems. We strongly recommend that people stick with the professionals.
How much do you think that should cost?
Depends on the design of the home, the age of the home, things like that. But right now, between $1,000 to $3,000, and which is very steep. So if people are looking for a bit of assistance, Colorado Department of Public Health and Environment offers the Low-Income Radon Mitigation Assistance Program. This is for Colorado residents to reduce radon in their home, and you have to be a homeowner and meet specific income limits. And the program would cover up to 100% of the cost of the mitigation system installation.
That's great. Thank you so much, Lea, for joining us.
Dr. Mayer, how would you recommend healthcare providers in Larimer County address the risk of radon with their patients?
I think the most accurate thing to say is that the entire state of Colorado is high risk for radon. If you pull up the map of radon risk for our state, almost every county is in red, meaning the highest risk. There's a couple of counties in the south part of the state that are orange, and even they're at increased risk. So I really think the most accurate thing to tell your patients is we're all at risk, and everybody needs to follow the testing guidelines.
What risk factors should providers consider when talking about radon?
I think the main time is to think about testing are when you purchase a new home. And I think it's important for us all to realize a home is where we live. It doesn't have to be a house. It can be an apartment, any other dwelling where we live. It's important to test when you've newly changed your residence.
Where can providers go to find more information about radon?
CDPHE has an excellent site. If you Google about radon, CDC also has some excellent information.
Awesome. Thanks so much, Dr. Mayer.
You're welcome.
We celebrate Radon Action Month throughout the month of January, but you can get a free radon test kit any time of year through the Colorado Department of Public Health and Environment, or purchase a test kit online or at retail stores. To learn more about radon and how to get your free test kit, visit larimer.gov/radon. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.